Good afternoon, and welcome to our series of webinars focused on bringing you information about COVID-19, infection control, and other nursing home-related topics. The information in these weekly webinars is geared toward long-term care and skilled nursing facilities, but we encourage everyone who's interested to attend. My name is Kathy Caudill. I'm a communications specialist with Quality Insights. Today's webinar topic is Commitment to Excellence, Introduction to the Nursing Home 5-Diamond Patient Safety Program. Everyone has entered the meeting on mute, but we will have a Q&A following the presentation. If you have questions or comments, please submit them using either the chat or the Q&A tool in your Zoom menu. We invite you to join us every Wednesday for more of our weekly webinars. Next week's topic is Back to Basics QIN-QIO, Infection Control, and that webinar will be part one of a 4-part series demonstrating how to improve infection control in long-term care using the Quality Assurance and Performance Improvement method. And if you'd like to join us, that will be the same time and place next Wednesday at 2 p.m. Today's webinar is an introduction to Quality Insight's new Nursing Home 5-Diamond Patient Safety Program. We will hear from some of the developers of that program, starting with Quality Insight's Medical Director, Dr. Jean Storm. Dr. Storm, thank you for joining us today.
Thanks, Kathy, and thank you everyone for joining us this afternoon. This is a program I am very excited about, and so I'm going to be just introducing it a little bit today. The culture of safety concept originates from high reliability organizations, which are sectors that manage complex, high-risk activities while minimizing adverse events. It emphasizes creating an environment where safety is a priority at all levels of an organization, from frontline workers to leadership. The culture is built on key elements: recognizing the high-risk nature of the work, which is long-term care, fostering a blame-free environment, very important, where errors can be reported without fear of punishment, promoting collaboration across roles to solve safety issues, and ensuring resources are allocated to address safety concerns. In healthcare, including long-term care facilities, fostering a culture of safety is crucial for reducing errors and improving patient outcomes. A healthy safety culture can lead to fewer mistakes, better communication, and a more supportive environment for both residents and staff. For example, nursing homes often experience safety challenges due to factors like high staff turnover, something I'm sure you're all familiar with, communication gaps, and complex care needs. We take care of very sick people. When a culture of safety is in place, staff feel empowered to speak up about potential risks or mistakes, which leads to quicker resolutions and a safer environment for residents. However, challenges still remain. A lack of trust in a blame-free environment and poor organizational commitment to safety are common barriers. For instance, long-term care workers, especially nurses, might hesitate to report errors if they fear that they're going to be blamed. Creating a just culture helps address this by distinguishing between human errors, which are natural, at-risk behavior, and reckless actions. In a just culture, individuals are held accountable for reckless actions, but systemic issues are addressed to prevent errors from happening. Makes all of our jobs easier. To assess and improve safety culture, long-term care facilities can use the AHRQ Safety Culture Survey, which we're going to be talking about today, which measure perceptions of safety among staff. Organizational commitment is key to ensuring improvements stick, and leaders must engage with frontline workers to understand the challenges they face. Effective teamwork, communication, and leadership involvement can lead to meaningful changes in safety culture. And ultimately, what we're all working towards is better care for residents. Thank you so much, Kathy.
Thank you, Dr. Storm. Next, we will watch a pre-recorded demonstration of the 5-Diamond Program's Learning Portal, and this is by Quality Insights Project Coordinator, Misty Kevich. And I will share my screen with this video. Misty could not join us today. right, I'm going to hit play, and please let me know if the video sound is working okay.
Thanks very much. I'm going to do a demonstration of the Nursing Home 5 Diamond program. I'm Misty, and let's get started so you can see what to expect. So what you will need to do to register for the first time into the Nursing Home 5 Diamond site, because you're going to be registering as a facility, not your own username that you already have, that you might be taking other courses or doing other work. So you're going to need to type in, and you'll see at the top, nh5d.qualityinsights.org/learn. And that's on our flyer and instructions for you already. But that's what you're going to do is log in. You're going to go ahead and hit enter, and you're going to come to the page where we're going to need to register for the first time. Here we go. Here's the sign in. This is where you're going to be coming when you're registered. But where you're going to go now for the very first time, because you're going to need to register as a facility using your CCN number as your username. So let's see what that looks like. You have a username, and it's required. This needs to be your CCN number. Whatever that is, you'll put that in, because this will be the facility. You will need to put an email in, but if you are already in my QI, you're going to have to use a different email. It can be a home email, or you could see if your work could give you a secondary email, but whatever that might be, you would enter it. You would enter it as your email here, and it will let you know if you've used an email when you go to submit this. You will put your name, because you're the contact for the Nursing Home 5 Diamond program. You will need a password. So follow the instructions. There's a language required. And you are already going to be signed up for the correct branch by coming in this way for the Nursing Home 5 Diamond. Go ahead and accept, and there is a next button. Here you will repeat your CCN number. You're going to put your organization's name. We'll just give this as ABC. And then you will click register. I'm not going to do that right now, but what will happen is you will get a message that says an email has been sent to your mailbox of what you put on this previous screen as your email, and it will give you a link to click, which will accept you as into the program, and it will remember you. So the next time that you go to log in, it will remember you. So let me go ahead, and I'm going to come in to an account that I already have set up. So this is where you would come. You go ahead and log in with the green bar and do it. I apologize for my throat. 'Tis the season. And you're going to come into the 5 Diamond Nursing Home site. Now, there are going to be a lot of courses down here, and you're going to see little lock boxes. But I'm going to give you a little trick, how I find it the easiest to get around. Go up to the left corner, right up at the top, you'll see 3 lines. Now, our communications team likes when you hover over it, it kind of looks like a hamburger. That's what they call it. So you go to the hamburger at the left corner, click it, and go to My Courses and Learning Plans. It's going to bring up, again, the same courses that you saw, but you're going to see the learning plan will be more to the top. And it's just an easier way to come in by clicking through the learning plan. So in the plan, you're going to see a description, and you can see a little bit more. There are all the courses that are available. But again, notice everything is locked except the first course. And this is the Nursing Home 5 Diamond Culture of Safety. It's mandatory for everybody to take first. And this course will be a little different than the other courses. And I'm going to show you what will unlock after you finish this course. So let's go ahead and take a look at this course and get started by clicking play. Over on the left, under the syllabus, is your lessons. Not all of the courses will have more than 1 or 2 lessons, probably 2 minimal. But in this course, we have several. So we'll start at the top. And they do say complete. I'm sorry, I meant to clear that this morning before we got started. But we'll just continue along here. And we are going to download it. It'll say to download. And all this one is a handout. It is a assessment that you need to provide to all of your staff to get their sense and their opinion of your culture of safety. This will be the pre-assessment. So this you'll just need to save or download or print. This will be what you're going to ask your staff to answer, and then you're going to tabulate the results. And I'm going to show you where we put those in just a few minutes. So we're going to go back to, oops, I clicked out of there. Sorry. We're going to come right back in. And we're going to go to the next one, which would not say complete yet. It would be the culture of safety. And this is the education piece. And this is the video that has been recorded. Each of the courses will have a video of the education. It will not turn to complete until it's finished. If you're sharing it in a small group or in a group setting, you can just come down to where it says YouTube, click on the little box here, and it'll make it full screen. And it will continue to play and continue to go through the information. You will have already done your first assessment, but this is starting to build on that knowledge for your staff about safety. And when you're all done, you can click again on the little box by YouTube, and it will go back to regular screen. And I'm just moving along so you can see what happens. In a few minutes, I will show you the continuing education sheet, and it will give you a link for the video and or a QR code to get to the video, because some of your staff, especially like your night shift, may need to do this on their own to watch the video. They need to complete the education, however, either in a group setting or individually. And once this is done, completion will come up. The next piece that we would be required to do is this reporting form. So I showed you what we downloaded, this form, and it has a variety of questions. And you're going to tabulate out how many people answered most of these questions. And I'm going to show you how to put them into this field here. And I am going to retake this. You would normally just start your answers. And you're going to come in, and this is going to be the first question. And it's a question to you. What disciplines or what staff titles are participating in this program? And you would just click whomever it is that will be, you skip with who is not. And once you've done that, you move on to the next question. Here it has, please enter the summary responses. So this is where you're going to tabulate off of that paper sheet of what your staff responded. So does say question 2 here. And if you will notice that it does have a variety of questions here, but they are all really about question 2. This is an oddball question. So we're going to ask you a variety of how many people answered A, excellent. And you would type in just that number. Question number 2, how many answered B? You would put in your number that you totaled. How many answered C? And how many answered D? And how many answered failing? Again, we're trying to get a baseline so that we can see if there is improvement by the time you reach your 5-diamond status. The next question is the total number of staff who agreed to the following questions. Again, just come down to where the actual question is. So question 3 is going to correspond to question 3 here. So in the center, we work together as an efficient team. And it's only going to ask you how many agreed. So in this point, I would put how many people agreed with that statement, and I don't need to worry about the rest. Go to question number 4, looking here, and how many answered 4, you would answer that. And then you would continue on. Some of these will be in the negative. It doesn't matter. We're looking for how many people agreed with the statement that is on the paper, and they're all related to safety. And once you get these all in, as I progress, all right. And you only will do the pre-assessment at the beginning. You will do the same questions later, and I'll talk about that in a minute. But the other courses do not have this information. You only will do a pre and a post. But once you've answered them all, and I think I missed one here, so let's get one here. I'm going to submit the test, and this will then turn to complete. So when you click upload your staff education sign-in sheet or sheets, you're going to see this box here, and you're going to click go to submission area. And you're just going to give it an assignment name. We know this is the culture of safety sign-in sheet, so that would be fine. Safety sign-in sheet. And it can be more than one, as I said before. If you can put them together, that's ideal, but you don't have to. What you're going to do is upload in this first thing, upload files. This can be done with PDFs, image files, it can be Excel files, it can be Word documents, it can be whatever that you need. And I'm going to go grab the files. Pull these back over so you can see, like I'm going to bring up 3. So you can have them separate or they could be combined together. But if I had a course sign-in sheet for culture of safety, but maybe I have some additional ones. So I'm going to go ahead and put 3 different ones in here. And it can be an image file as well. And give it a second, and you can see down at the bottom here, it's uploading the files, or at least getting them ready. It's kind of like turning in your test. Until you submit assignment, that's when it's going to accept it. So submit your assignment. This will turn to green, and you will be done with the lesson. And you can scroll down. You'll see the description here. If there are handouts, they'll be here under the repository, but each of the courses will have a continuing ed sheet, even if there are not approved CEs. So it will tell you information. It's going to provide you links. So you just would download that. And I already have one ready for us to look at. And here you can see in this course, there are nursing, dietitians, social work, and a little blurb about other disciplines too. Because there are CEs, they will have to take an evaluation and a post-knowledge check. And I'm going to show you that in a little bit. But on this second part of the sheet is the link to the video. And then there's a link here. So you can provide this to your staff that they can either click if you send it electronically to them to watch the video. They only need to watch the education once, or they could use a QR code and watch it off of their phone. And when they're done, they just need to take the evaluation. That is the link there that I just clicked on. And let me get let's try that again too. And or the QR code here. And I'm going to show you that in a minute on another course. There is, again, how to get a hold of us. So we're going to go back to the course. And you remember we've completed everything here. So we can just go to the next course, or let's just go back, because most likely you're going to have finished this and we're going to start all over again from the top. You're going to come in and come back to your learning plan and decide what courses you're going to take. The courses, remember, were locked when we first looked at them, but now they're all are open and available for you with one exception. This nursing home 5 diamond program review. This is still locked because it will not open until you complete 5 courses, the culture of safety and 4 additional ones. And then what it's going to ask for you is you're just like we had the pre-assessment, you're going to get a post-assessment, and it will be the identical questions that you're going to need to enter. But that's not going to open. You're just going to pick one of these other courses that you're going to want to take next. And when we get back, after we finish the demo, they're going to provide you with a nice link that'll take you to a web page that you're going to be able to see all the courses on one screen, and you can decide. But you would look at the titles and the description to see if this is an area of need at your facility. That will probably be your factor that's going to drive which course to take next. The other thing that might be important would be, are there CEs? That's kind of important for us. So let's take a look at a course that does have CEs, and this multi-drug resistant organism course does. So let's take a look at this real quick. I'm going to just fly through the lessons, and you can see actually this is the education lesson, and it's in progress because I took a peek at it earlier, and I have the audio off, but I'm going to go ahead and get through this. So it's going to end up saying complete because we would have watched the education together. We would have done the sign-in sheet just like we just did before. On the other one, give it a name. You would upload. I'm just going to put sample here. You would just go in. I'm going to repeat this just one more time. And you would find your file that you have, and you would upload your sign-in sheet and submit your assignment. And as that's submitting, we are going to continue. Okay, leave assignment. We'll do that. And you can see it's now complete. And down under that repository, under the description, there were some other handouts. In fact, there are 3 here, but you can see there is 6 total. So I'm going to do it over. And I'm going to get the education sheet for this course. And as a staff person, I just participated in the education as in a group setting. So all I need to do is my evaluation. So you, as the facility representative, you would be providing them the handout or the QR codes to do the evaluation. And it's coming in. Here we go. So we're going to go to the evaluation link, which is right here. And I wanted to demonstrate to you how an evaluation goes to the post-test. If there is a post-test. If there are no CEs, it's just a very simple evaluation. But in here, we will add our information. And the CCN, if they know their CCN, they can put it there. It is not a requirement. So they will, they can miss that if they need to. All right, and then they would do an evaluation, and this is of the objectives for this course. They're going to select their confidence level before and after. Okay, there's a lot of, here we go. And then just questions about the handouts, the presentation, the style, and they'll answer these few questions. There's I'm just going to put some information in here. They're going to ask a question about how they could use that S bar tool, and they click done. It is going to take them directly over to the post test. They will have to put in just a couple pieces of information to make sure they validate it is the same person. And then they can begin the post test. They have to do 80%, and it does state that at the top. They can take it as many times as they want. So I'm going to go ahead and see if I can pass this on the first time. Let's see. And if not, they can hit back and retake it. We'll give them a score. So I did score better than pass, and it tells them here to scroll to the bottom and click done. And it will bring up their certificate for completing the course, and the CE information will be on there. If they just want a certificate completion, this is exactly what they would use. They would fill this in, they can save it, they can print it, but that's how they get to their certificate. So that's how you would just continue to work through your courses until you've reached 5. And once you have submitted the evaluation data after you do it the second time, because the nursing home program review is going to stay locked. But once you do that, you will receive your 5-diamond certificate at that point. Anytime that you have any questions, do feel to reach out to us. In all of the courses, there is under the descriptions, there is the email address. They're on the continuing ed sheet, or you can reach out to any of the Quality Insights folks. One other thing is, remember from the beginning when you registered as a facility, you registered with your CCN number, but you did your name and your email. If for some reason you end up leaving, say in a month, couple months from now, and somebody else is going to take over being that key person, or perhaps you no longer have the time to do that, and someone else is being designated at your facility, you just need to reach out to us or to Deborah Wright and let us know. We'll change it on the back end. That's why you're signing in with your CCN number. We can keep your history of what you've done. You don't have to start all over to achieve that 5-diamond status. So I know we've kind of walked through a variety of the pieces. There are information sheets that you're going to get when you're ready to register, that with the simple instructions to get started. But we're more than happy to help you out in any other way. So thank you and good luck in your journey in achieving 5-diamond status.
All right, that is the end of Misty's tutorial. And next we will have Deborah Wright speak. Deborah is a quality improvement specialist at Quality Insights.
All right, thanks, Kathy. I was trying to keep up with some of the Q&As throughout the session. Kathy is going to bring up the landing page for the 5-diamond, and we're just going to kind of talk through that a little bit. Some of the other questions, other than what's in the Q&A that I've gotten over the last week or so, has been that they see some nursing CEs, but not NHA or NAB credits. We have added 4 programs that also have NAB credits, or NAB, I guess that's NAB, credits, and we'll show you that on the list here. So we are trying to, we will be adding more programs as time goes on and evaluating whether those programs are appropriate for nursing or administrators, CEs. So as Kathy goes down through this list here, you will see that once you take the culture of safety course, there are a number of courses based on what your facility needs are. So there are a number of infection control modules, and that is what we added. We actually added 4 of the 4 modules from our infection preventionist leadership boot camp, 4 modules that we feel is basic knowledge, basic education for your infection control program. And those are the ones that also have the administrator credits with that. There's also other things if you're working on opioids or falls, high risk medications. There's a lot of different things in there. While the directions say, 100% of your staff need to apply and answer the culture of safety assessment for that first module, we realize that that may not always be completely realistic. So it's going to be up to you to determine what an acceptable number is for that. But the hope is in order to get 5 diamond status, it's a facility as a whole. It's not just 3 or 4 key leadership people. It's not just the administrator or just the staff development person. It's your facility as a whole. How do they feel the culture of safety is at the facility? So you do want to make an effort to have as many staff participate as you can, but it's not like we're going to say, oh, you have 105 staff, we only see 100 responses, and that's not what's going to happen. It's a good faith effort to get as many responses as you can for that, and how you wish to roll this program out. One of the other things is with the uploading of the education sheet. Now, we have an education sheet in that repository, but we also realize many of you have your own staff education sheets. You can use your own. You certainly don't have to use the one that's in the repository. That's just there for facilities that maybe don't have one or wanted something more related to this. You can use your own facility staff sign-in sheet for that. Once you do an upload, though, it is locked. So you can upload as many sheets as you want, but once you hit that final submit button, you won't be able to upload anymore. So if you have the majority of your staff and you want to move on to the next education, you can upload as much as you have. But if you're like, Deb, I got another whole, 20 people done, and, I want to make sure that that sheet gets uploaded. At this point, the only workaround for that is to send that sheet to me, and we can upload that on the back end and make sure that that's part of your learning plan. Let's see, what else are some helpful hints? For right now, some people have been saying that, they don't see the lesson plan when they log into MyQI. It's a manual registration. So this is a pretty big program for us. It's new for us. So the only way to add it to your learning plan is for us to manually add it when you request it. So it's something that you want to talk to your team about, see if this is, an educational path that you want to take and a commitment that you want to make, and then we will get that learning lesson plan added to your learning plan. We also know, because this is new, there may be bugs. We have test piloted this with a couple facilities, have worked out a number of issues, but certainly if you are hitting a roadblock at any point in this process, please just reach out to one of us and we will work with you to do that. Because if you're hitting that roadblock, others are probably hitting it as well. And we want to be able to constantly improve and make this a good program for you. So at this point, we will open it up and see if anyone has any additional questions. But I think the questions will probably start coming once you're in the system and you're working with it. And then you can just, again, continue to reach out to us and we'll be happy to help along the way. I put the wrong CCN number in. How do I change it? You can't. Did you finish the whole process, Lisa? If you finish the whole process, probably the best thing you could do is shoot me an email, and we'll have to work on the back end to get that changed. Tandria and Andrea, is that something that we can do on the back end?
We should be able to.
Okay, so Lisa, if you just want to send me what wrong CCN number you added in your facility name, and then the correct CCN number, we should be able to get that changed, and then I'll let you know once that's fixed.
Thank you for your question. If anyone else has a question, please submit it using either the chat or the Q&A tool in your Zoom menu. Deb, you had some questions that came in while Misty's tutorial was going on. And if any of those, I think you think would be good to read to like the audience here, if it applies to more than one people, we can read some of those out loud as well. I put Deborah Bright's email in the chat for anyone who needs it, as well as the link to this landing page. And in a moment, I'll also put in a link to an informational flyer that you could also have on hand. While we're waiting for, oh, sorry, go on, Deb.
Sorry, go ahead. Go ahead.
I was going to do the wrap-up notes. Did you want to say something before?
I was just going to read some of these Q&As if you wanted me to. So how do I know what my CCN number is? Someone in your leadership should know what your CCN number is. It is also in section A of every MDS. So if you want to get with your RNAC or look at an MDS, it's also always there for your facility. If you still have trouble, you can certainly reach out to us and we can get that for you. Staff members completing the pre-assessment, we've addressed that. We've addressed, I went into the platform. I don't see the program. I see that it's closed for 2024. We will get you manually registered for that just by sending your facility name, CCN number, who the primary contact will be, and you can send that to me, and Kathy put the email in the chat. I think that's it from the, let me see, I think there's more in the Q&A though. Hold on. Okay. I think I've answered all the questions, Kathy.
Hey, Deborah, I did want to mention, I see here that someone had logged in and it says that the program is closed for 2024. You should know that we do have more than one 5-diamond program. So if you just Googled 5-diamond, there is an end-stage renal development, end-stage renal disease 5-diamond program that we also house. And that program is closed for 2024. So it's best for you to use the links that are provided here in the chat, as opposed to just Googling to make sure that you get to the right place.
Thanks, Tandria. So Tandria and Andrea have joined us. They are part of, I'm going to call them our, for your purposes, our backdoor people. They're the ones that are working diligently to keep the program up and running and created it. And they're definitely our right hand when it comes to working on the behind the scenes things with this program.
All right, thank you, Tandria, and thank you, Deb. So at this time, if anyone else has a question, please submit it using either the chat or the Q&A tool in your Zoom menu. And while we're waiting, I'd again like to invite everyone to next week's webinar, which will be about Back to Basics QIAP infection control. That webinar will be, again, part 1 of a 4-part series demonstrating how to improve infection control in long-term care using QIAP, and that will be next Wednesday at 2 p.m. You can find the links to our webinars in the newsletter we send out every Friday called the Last Minute Lowdown. And if you'd like to receive that newsletter but don't think you're on the mailing list, you can email me at ccaudell@qualityinsights.org and I will get you on that list. And I will put my email in the chat. And I don't see any other questions coming in, so I think we can wrap up here in a moment. Does anyone who's on the call, any of our panelists today, have anything you want to add before we close out today?
Just feel free to reach out with any questions that you have, like I said, and we'll be happy to get you registered and get you on the right track with this great program.
Thank you, Deb. And I'll be sending a follow-up email to everybody who registered for this webinar today. So you'll get a link to the recording and any other links or contact information that I provided here in the chat today. And I think I'm going to go ahead and wrap us up. Before we sign off, we'd like to ask everyone here to please answer a short evaluation of today's webinar. It is anonymous and it will show us a pop-up as soon as the webinar ends. So if you have a couple minutes to fill that out, we would appreciate it. Deborah and Dr. Storm and Tandra and Andrea, I'd like to thank you all for joining us today. And I'd like to thank our attendees for joining today, and we hope to see you here again soon.